Good morning, everyone. I'm going to talk today about VAERS reporting. That was something that Dr. Gold pointed out in our last call that people, I think, still misunderstand. And it's really been an effective tool that the anti-vax campaign has used actually for quite a number of years, going back well before the start of the pandemic, but obviously it's accelerated. And it's part of an overall strategy of using data and information that appear to be valid and appear to be scientific to confuse people and to weave this alternate reality, which at some point either just confuses people so much that they give up, or it sometimes actually convinces people that this alternate reality is real. So it's kind of a form of gaslighting there. So this was a report that I saw just a couple of days ago that was given to folks, and it is a VAERS reporting system report. So this is a system that the CDC has called Wonder, which allows you to explore VAERS data and create custom reports. So you can see this is a report about the COVID-19 vaccines, seeming to indicate that there have been, over 14,000 deaths, 14,000 life-threatening, and over 18,000 permanent disabilities associated with the COVID-19 vaccine, and all of these other things, congenital anomalies and birth defects, which are verifiably false, but at first blush appear to be concerning and look as if the vaccine has significant amounts of adverse events associated with it. Now, if you go to the CDC's site on COVID-19 adverse events with the vaccine, you can see the up-to-date and epidemiologically supported evidence for adverse events with a number that we have been talking about and are familiar with, including a rare but real occurrence of anaphylaxis, as we see with any vaccine or medical product. About 2 to 5 per million so far who've received the COVID-19 have had some anaphylactic reaction. Now, that does not indicate death. The rate of the mortality rate from anaphylaxis is in the low percents, a couple of percent, but still there have clearly been deaths associated with anaphylaxis from the vaccine, which you are going to expect if you're vaccinating over 170 million people so far. More if you're including single doses. The TTS, thrombocytopenia with thrombosis syndrome, which we've talked about, occurs most commonly in women receiving the J&J vaccine. And again, the rate is reportedly about 7 per million that have been documented among US vaccine recipients. And then myocarditis and pericarditis, which we've seen more frequently in young males, have 963 confirmed reports, and there are other epidemiological studies that indicate that there have been more than that, but the incidence again is in the dozens, 200 per million, and I've laid out the math about that in terms of the dramatically higher risk of myocarditis and pericarditis from actually getting COVID-19, not to mention all of the other adverse events in young men. So the bottom line is that the true known associated adverse events associated with the vaccine are much, much lower. And there's a reason for this, and that's because VAERS is intentionally established to capture any and all potential adverse reactions, whether or not people think they were related to the vaccine or not. And you can see that that's actually specifically pointed out in the disclaimer for the VAERS system that comes up on the first page when you look at CDC VAERS. And you can see that highlighted on the right there. I extracted some of the most salient comments. One is that vaccine providers are encouraged to report any clinically significant health problem following vaccination to VAERS, whether or not they believe the vaccine was the cause. And I'm sure that most of our providers here have at some point submitted reports to VAERS. And in many cases, we didn't necessarily think that the vaccine was the cause, but we thought it was important to make sure that it was documented. And the reason for this is because in rare instances, VAERS has been able to pick up the safety signals of very rare events, but real events that can be associated. One of the best examples is in the late 90s, there was a new rotavirus vaccine that was approved in the US and was given to kids. And VAERS actually over the next year picked picked up the pattern that a small but significant number of kids developed intussusception, or intestines essentially folding in on themselves, which is an emergency and often needs surgical repair. And developed intussusception after the vaccine. And it turns out that that was a real association, that more in-depth studies found that that was rare but true. And so in developed countries where the risk of serious rotavirus infection leading to dehydration and death is very low, a decision was made to take that vaccine off the market. The rotavirus vaccines are still widely used in the developing world because the risk of dehydration and severe outcome from rotavirus far exceeds the risk of intussusception. But that was an example where VAERS actually did its job, and that's exactly why VAERS is around. But you can see that anybody can make a report to VAERS, including the public, and that these reports are acknowledged to contain incomplete, inaccurate, coincidental, and unverifiable information. All of these reports are voluntary, which means they are subject to bias. So if you search the CDC Wonder database, again, which pulls the data from VAERS and gives it in a customizable report, they go through this similar adverse VAERS disclaimer again before you are able to actually search the database. You actually have to click on a button acknowledging that you've read the disclaimer and that you understand it. So it is not as if people who've used this database for misinformation don't understand the reality of what VAERS is. And a number of people have done studies on kind of validating reports that have been put in VAERS. This is one, and you can see it's from 2012. So again, long before COVID-19, looking at the validity of VAERS reporting, this group actually went through the 15-odd thousand case reports from a year, I believe it was 2010, but don't quote me on that, and randomly selected reports, weighting it towards severe event reports. So 75% of the reports they looked at were severe event reports. And you can see based on their random sampling, what they came up with severe events that would be related to vaccine. Lyme disease, which I doubt a vaccine makes a tick more likely to bite you. Lung cancer, which again, don't think we've had any recording of a vaccine being linked with any kinds of cancers. Feeling weird, which is obviously one of the less severe reactions, and a lot of other things in this list you can see, which would be far-fetched to be potentially associated with the virus or with the vaccine, excuse me. And what they found in this analysis is going back and actually looking at the medical records for all of these reports and doing an in-depth expert consensus on the medical records and the history, found that only 3% of these mostly serious VAERS reports were actually definitely linkable to the vaccine. The vast majority of them were either unlikely or completely unrelated to the vaccine. And so there's been a number of media reports that have done fact-checking about VAERS. And again, this goes back long before COVID. You can see this PolitiFact fact-checking on VAERS was done in 2017 after a little row that happened in the Texas state legislature. But this reporter was able to go back and document a couple of interesting occurrences in VAERS, including one where a neurologist intentionally submitted a report into VAERS that claimed that a vaccine had turned him into the Incredible Hulk. And it wasn't until several months later that a CDC epidemiologist who has the task, there's a team of them that have the task of verifying all these reports, called to ask permission to remove that report from VAERS. Because this is a voluntary public reporting system, CDC actually can't remove that report unless the submitter volunteers to allow that to be removed after they've talked to the CDC and maybe have discussed the fact that it is unlikely that this vaccine turned the person into the Incredible Hulk. But if he had not agreed to removing that report, it would have stayed in. And so you can imagine, especially with the amount of excitement and zeal that the COVID vaccines have elicited among the general public, the number of different reports that have gone into VAERS for COVID-19 vaccines that probably are of similar veracity. So that's what I wanted to talk about in terms of VAERS, and happy to answer any questions.